Pharmaceuticals Part 6. In this part, we will see some more drugs, their synthesis and uses. So, sixth class, that is antibiotics. Chemical compounds derived from or produced by living organisms such as bacteria, fungi, molds, or their synthetic analogues, which are capable of inhibiting the life or process of the microorganism at low concentration are known as antibiotics. That means chemical compounds produced by either living organisms or their analogues which are able to inhibit the growth of causative agents of diseases are known as antibiotics. The term antibiotic has its origin in the word antibiosis, means the concept of survival of the fittest, that is, a process in which one organism may destroy another to preserve itself. Term antibiotic was first time used by Fleming in 1889. In 1928, Sir Alexander Fleming at St. Mary's Hospital, London, observed a contamination of culture plate of Staphylococci by spores of species of penicillin mold. Fleming noted that the bacteria colonies surrounding a large colony of contaminating mold had become transparent and obviously were underlying lysis. Fleming gave the name penicillin to this antibiotic substance. It is effective against a variety of gram positive organisms and non toxic to animals. Flore and Chen in 1938 succeeded in isolating penicillin, and in 1941 it was first tried on human patient. Antibiotics are much preferred to other type of drugs because of their high potency and low toxicity. They have also a broad chemotherapeutic spectrum, that is one antibiotic is able to cure various types of diseases. That means they have broad spectrum of their action. The other well-known examples of antibiotic are streptomycin, chloromycetin, tetracycline, neomycin, ampicillin, amoxicillin, etc. These antibiotics were found to be very useful in the treatment of infections which were found to be resistant to other chemotherapeutic agents. So, first example of antibiotic for our study is chloromycetin. The structure is this one. The name is D3O minus 2,2-dichloro N beta hydroxy alpha hydroxymethyl para nitrophenyl ethyl acetamide. And chloromycetin is a levorotatory broad spectrum antibiotic. It is originally produced from several streptomycetes such as Streptomycetes venezuelae, Streptomyces, Streptomycetes omiamensis by Elrich et al. In 1947. Synthesis of this chloromycetin. So here multi-step reaction sequence is there. Paranitroacetophenone on bromination gives paranitrophenylbromide, bromide, which on treatment with hexamine followed by acidic ethanol gives alpha amino paranitro acetophenone hydrochloride. This alpha amino paranitro acetophenone hydrochloride on acetylation with the help of acetic anhydride gives paranitro acetamido acetophenone. And this paranitro acetamido acetophenone on treatment with formaldehyde followed by aqueous sodium carbonate gives corresponding hydroxymethyl derivative. This hydroxymethyl derivative upon MPP reduction gives DL form, and this DL form of the intermediate further upon hydrolysis in presence of hydrochloric acid yields DL form of chloromycetin base. And this DL form of chloromycetin base on resolution by reaction with dichloromethyl acetate gives minus chloromycetin. This is the multi-step reaction sequence by which we can synthesize chloromycetin starting from paranitroacetophenone. Uses of chloromycetin. It is used to treat infections of eye and skin. It is employed for rickettsial infections like typhus and Rocky Mountain spotted fever. Typhoid fever and similar salmonellal infections are treated by chloromycetin. It is also employed in acute infections due to Haemophilus influenzae, including meningitis attributed to ampicillin resistant strains. It has also been used to eradicate vibrios from patients with cholera. It is active against certain gram negative and gram positive bacteria as well as viruses. And the seventh class is anti-cancer drugs. So in anti-cancer, first drug is chlorambucil. So this chlorambucil has this one structure 4 para bis 2 chloroethyl aminophenyl butyric acid. It is related to mecalorithamine and having similar pharmacological and toxicological properties, including its action on central nervous system. This chlorambucil anti-cancer drug can be synthesized. And the synthesis of chlorambucil from 4-phenylbutyric acid. This 4-phenylbutyric acid upon nitration gives nitro compound. Here nitration takes place on the para position of the 4-phenylbutyric acid. This nitro intermediate, further upon esterification, With methanol gives corresponding ester, and this ester, upon reaction with calcium carbonate and palladium, followed by reduction, we get the amino compound. This NO2 group have been reduced to NH2, and this amino intermediate further reacts with epoxide in presence of acetic acid, and the reaction gives this intermediate which has this structure, and this NN dialkyl derivative further reacts with thionyl chloride SOCl2, and we get dichloro derivative. This dichloro derivative further upon hydrolysis yields chlorambucil. This is the synthesis of chlorambucil from phenylbutyric acid, 4-phenylbutyric acid. Synthesis of chlorambucil from acetanilide. So simple compound acetanilide reacts with this acetamide, sorry, acetanilide. This compound reacts with succinic anhydride in presence of Lewis acid, AlCl3. Acylation takes place and we get acylated product. This acylated product, that is acid derivative, further upon esterification gives us ester COOCH3, and this ester upon base hydrolysis gives us amino derivative. This amino derivative further reacts with epoxide and we get diol derivative. This NN dialkyl diol derivative further upon reaction with POCl3 and H2O yields chlorambucil. This chlorambucil is well absorbed when administered orally. It is the shortest acting nitrogen mustard. It is used for chronic lymphatic leukemia and for multiple myelomas. Synonyms of these drugs are leukeram, ambochlorine, and others. On administration of large doses, nausea and vomiting may occur. These are the drawbacks of taking chlorambucil. Thank you.